that's important, and then we should be able to push data across electronically so that we know what tests have been done recently on patients. We don't have to actually guess. We also should know more. We should have more data on our computers as far as appropriate use criteria for testing, so that the right tests are done at the right time. And we also should have decision support software that allows us to make the right decisions for your care. This all needs to be done, but this is very expensive, and we need help in doing so. Clearly, we need insurance reform. I think the President is right about changing the topic to health insurance reform, because in fact, the insurance industry in the United States, I perceive to be organized crime. They're not good for you, they're not good for us. They require us to pre-authorize tests. I speak to psychiatrists and neurologists, and nothing against psychiatrists and neurologists, but I speak to psychologists and psychiatrists and neurologists to approve tests that I'm trying to get done for my patients. And I should be talking to a cardiologist if they really want me to talk to somebody about a test that I think needs to be done. Additionally, they make it very difficult for us to practice medicine today. The number of forms that we have to fill out, the things that we have to do for patients, all add costs and time to our day to make it more difficult for us to see patients. The denying of tests and things and medications for patients is just abhorrent. The insurance company, most of you know what a medical loss ratio is? Do you know what a medical loss ratio is?
No.
Okay, medical loss ratio, for those who don't know, is a fraction. And that fraction is the numerator, the top number of that fraction is the amount of premium dollars that's spent directly on healthcare issues. The denominator is the total amount of premium dollars that are collected by the insurance company. And that number is about 60%. So therefore, somewhere between 30 and 40% of private insurance dollars are either profit or, quote, administrative costs. The administrative cost in Medicare, I think the present time is 1.8%. So there's a significant profit in the insurance industry. Most insurance companies are publicly traded companies, and they have to show huge profit. So what is their main principle? Their main principle is making money for their stockholders, not insuring the public. And we need to regulate the insurance industry. Just having them compete is probably not enough. But we also have, aside from the 170 million people that we have on public health, on private health plans, we have government-run health care. We have Medicare, we have Medicaid, we have CHIPS, we have the VA system, we have a number of government-run health care systems. Let me give you a reason why Medicare is becoming insolvent. In 1965, Medicare was passed by the Congress and signed by Lyndon Johnson. In 1965, 9 million people enrolled in Medicare. There were 11 taxpayers for every one Medicare recipient at that time. The average life expectancy of a 65-year-old entering Medicare in 1965 was 4 years. In 2009, we have 45+ million people on Medicare, and we haven't hit the peak of the baby boomers yet. We have 3 taxpayers for every one Medicare beneficiary, and the average life expectancy of a 65-year-old in 2009 entering the Medicare program is between 18 and 20 years. Okay, we've done a real good job in keeping people alive, and we've really improved the life expectancy. The problem is we can't afford it. Okay, so some of you got to go. What page was that death panel on? Anyhow, that's where our problems lie. We have a lot of people that we cover, and Medicare, the cost of Medicare is increasing exponentially. I think originally the cost of Medicare was supposed to be in the hundreds of millions of dollars, and now it's in the $500 billion range for Medicare. And again, we have not reached the time where people like age 57, have gotten there yet. So we're going to be in problems with Medicare. So what is Medicare doing? Medicare is now cutting reimbursement to physicians. When government runs a healthcare system, at least in the United States, they believe the best way to reduce cost is by reducing volume and reducing reimbursement per study or per visit or per whatever. And that's failed in the past and it's going to fail again. It's not a good way to run a system, for a healthcare system. I think Milton Friedman said it best, if the United States ran the Sahara Desert, in 5 years we'd be out of sand. And unfortunately, that's the case. Now, this is not a condemnation of single-payer healthcare. I'm not condemning single-payer healthcare. I'm condemning government-run single-payer healthcare. And I think that the United States government has difficulty in running healthcare. Most of you that are on Medicare like their health system, right? But on January 1st, we have a 21.5% reduction in reimbursement to physicians. And we have, in cardiology, for instance, a absolutely absurd change that occurred where they calculated the cost of us in our private practice and found that our private practice in the last 4 years has reduced the cost of doing business about 40%. Now, I'm not sure whoever owns a business here, does your cost go down 40%? So it's obviously absurd and it's bad data. But we're going to receive another 15% on top of the 21%, so we're going to have about a 35% reduction in reimbursement through Medicare. So what's that going to happen to me? I take care of 60% of my patients are Medicare, 40% are private. I'm going to have to go to 40% Medicare and 60% private, which means some of the patients that I see, that are the sickest patients that I have to take care of, I'm not going to be able to see. And I'm not going to be able to do studies in my office to help them and to make it more convenient that are cheaper in my office than are done at the hospitals. I won't be able to do those anymore on Medicare patients. I'm going to have to send them to the hospital where it's less convenient and it's more expensive for the patient and for the taxpayer, I might add. The cost of doing tests in the hospital are much higher than the cost of doing tests in my office. And so Medicare is going to pay more, and since your 20% copay is going to actually increase it too. So that's what's going to happen. We've been fed a number of disingenuous sound bites over the last several months in healthcare, in this whole debate. And we need to be smart enough to know which ones are the disingenuous, misleading health sound bites and which ones aren't. We've heard about death panels, and obviously death panels are not in any bill. We've also heard that if you have a blue pill and a red pill, that it's better if the blue pill is cheaper, that you should take the blue pill and not the red pill. Well, in some cases that's true, and in some cases that's not. We also heard the disingenuous statements from a very well-meaning president that if a pediatrician sees a patient with a sore throat, he's likely to take out their tonsil. And it's better, and more doctors would rather cut off your leg for $30,000 than treat your diabetes. Those are bad statements to make in public, and I think that they're untrue. We've seen a number of disingenuous sound bites, and we need to actually speak. We need to talk to our legislators. We need to talk to the president, and we need health reform that works. It is disingenuous to believe for 1 second that you can do health reform without medical liability reform. It is impossible to do that in this country. And I disagree with the slide you just saw. I do not believe for 1 second that there's $60 to $100 billion of defensive medicine. PricewaterhouseCoopers did a study that looked at this and actually said it was closer to $250 billion a year that's spent on defensive medicine in this country. And that's over-testing, over-admission for things that don't need to be admitted for just because of the risk of getting sued. Just for that risk. And defensive medicine is not good medicine. And if you saw the Voice of the People a few weeks ago in the Tribune, you saw talking about self-serving editorials by the president of the Trial Lawyer Association that said that people who are for medical liability reform are anti-health reform, and that in fact defensive medicine is good. Well, defensive medicine is bad. It's bad medicine. It's not good medicine. Good care is different than defensive